the decision. Here with reaction, Wisconsin Senator Ron Johnson. All right, let's stick to the science, Senator. I believe in science. I believe in the science of vaccinations. But I'm not a doctor. I've been pressured to tell people what to do. I'm telling people this. I want my audience to live. I don't want anyone dying from this thing. It's dangerous. Take it seriously. I want people, if you have a cell phone, there is a wealth of information, more than you could ever read, available for you to read. Also, talk to your doctor, your doctors that know your personal medical history, your current medical conditions. Consult other medical professionals you trust, and then make the decision in consultation with your doctor. I think that's responsible advice for everybody. My question is, why would they have this waiver at the border, number one? And number two, this country is now going to mandate vaccinations for people?
Well, Sean, first of all, your advice is absolutely correct. And the fact of the matter is what Democrats have wanted to create since the beginning of COVID is to politicize the disease and create the state of fear so they can maintain dictatorial control over the population. That's what's going on here. The fact of the matter is we have administered more than 300 million doses of the vaccine. The vast majority of those have been administered safely. The science tells us they're very effective vaccines. But the fact of the matter is I championed the right to try bill. That allowed individuals to have the freedom to make their choice whether or not they wanted to access a medical treatment or a drug that was not fully approved, which is what the vaccines are. They're under an emergency use authorization. They haven't gone through the observational studies that do take time. And so the fact of the matter is nobody should be pressured, coerced, or fear reprisal for refusing medical treatment, including the COVID vaccines. And again, it's just astounding the Democrats would try and mandate this, and it's being done to college students. It's being done at the workplace. And of course, the Biden administration says they're not going to have government mandate it, but they're going to do everything they can to support those that do want to impose this mandate and not give people the freedom to choose.
They told us repeatedly the mantra, follow the science. Okay, if we're going to follow the science, let me ask you, Senator, because I think this is important. They told us that if you got vaccinated, you'd be okay. You didn't have to worry if you got vaccinated. So if people took their advice, they followed the science, they got vaccinated, then why would they worry about what other people are doing? Because every American now knows they have an opportunity to get one of 3 vaccines that are available. And, as far as I'm concerned, I don't think they're following the science. If you had COVID, you had stated publicly you had it. Well, the Cleveland Clinic is highly respected, science research, right? They say that you wouldn't need any vaccine. Are they following the science, Senator?
No, they're not. And the fact of the matter is it looks like natural immunity is as strong, if not stronger, than vaccinated immunity. The science also tells us that very young children have a very low risk of really being harmed by having COVID itself, but there is a risk to the vaccine. Again, it's very small, but there's some pretty serious side effects, including death. We're already over 5,200 deaths reported on the VAERS system. That's the CDC, FDA's early warning system. That, by the way, exceeds the number of deaths reported on the VAERS system for all other vaccines over 31 years. We've had over 400,000 other adverse events reported. 10% of those have been termed serious. That's coming in about 15,000 a day versus prior to COVID vaccine is about 1,000 a day. Now, that's what the science tells us in terms of the numbers of the CDC's own early warning system, which now they're just not taking seriously. What I'm asking the health agencies to do is take a look at that, take it seriously, and certainly take the concerns of those people that believe that they've been injured by the vaccine seriously so they can get effective treatment.
They had at the border, we've seen the cages that they built for kids and unaccompanied minors and others that were so overcrowded in the middle of a pandemic, high rate of positive, COVID positive of tests that were given. But now they're not testing anybody. Then they're literally transporting people around the country and just processing illegal immigrants rather than enforcing the law, Senator. I don't know, maybe I'm old-fashioned, but I didn't think you're allowed to pick and choose what laws you want to obey. And I have a pretty strong belief if I'm caught jaywalking, I'd probably be in jail for the rest of my life, based on our justice system currently.
The Democrats want this state of fear for every place other than the border. And they want to suspend the state of fear there so they can allow 6,000 people per day is what we're apprehending right now. And now they want to relax the CDC's, this Title 42, which allows them to return some of those illegal immigrants back to their home country. That won't be the case if they suspend Title 42 restrictions. And so now we're going to have 6,000 people flooding into communities around this country. And again, they don't worry about COVID with those individuals at all.
Are you running in 2022, Senator?
I haven't made that decision, Sean. It's ronjohnsforsenate.com, though, if you want to offer some encouragement.
All right. If you want to communicate to the senator, we need strong conservative voices. Senator, thank you.